Hi everyone, I'm Dr. Abdulwali, cardiologist. I'm trying to give you strategies for MCQ, how to pass MCQ exam and what's the strategies that can help. My target group, medical students and physicians on board preparation. Hopefully these talks were received and used. The purpose of my talk is to learn the process to pass exam. I will provide simple ideas to think and remember, and the goal is to success in exam. Studies say to perform exam you need a knowledge in 60%, which are the informations that you need to pass the exam. 30% is the ability to deliver informations. It's like the procedure and the theory. 10% is the individual personality. So 40% it depends on you. If you know the skills and you change your personality, you will get 40% chance to pass exam. You should realize some factors, some facts. Exam is not a medical practice. Exam, it's not only the best answer. Make a little mental change. In real practice, it's not the case. In real practice, it's debatable to choose between A and B. It's not to choose the okay drugs or the okay option. It's to select the superior option, the clear answer. And who did decide this? Superiority is the senior who put the exam. It doesn't matter what you argue for. Second fact, exam is not a reality. It's the ideal answer. It's not like my boss is doing this or everybody is doing this. It's what's the ideal physician is ideal. In ideal situation will do. The ideal physician, ideal situation will do. It's what's the best person will do. Because the ones you do and your team is doing every day, maybe it's not the ideal answer. You don't look for what they are doing in institution. Look for what's the ideal standard of care. Exam is demanding your the standard practice. The third fact is exam is not to show that you are a smart student or brilliant or good physician. It's the harmony, the correspondence, the conformity should reel it in the way you should be. You should select answer the way it should be. Your answer the question like everybody else, not like brilliant person. You will answer as your colleagues will do. You don't read the question as an Einstein because he will fail. He will read the exam in a special way, in extraordinary way. The examiners doesn't care for your special insights. They care about the basic that everybody should do it. In psychology, if you remember, they say things that reinforced memory take it, and things that punished memory ignored. So, during your study effectively. I suggest you to retire your battery. The moment you start, slow down, stop, take a break, do a fun, talk to a friend. So study for 30 minutes and then break. 10 minutes, 30 minutes and break 10 minutes. So you create a place or study area and study environment. They say you cannot remember the name of the bone if it causes confusion, but if you make a fun of bone, it will stay. The fourth fact is the level of fact, or the level of confidence, level of certainty. It's what percentage you are sure before you do the cut. For example, before we are doing procedures in our practice, we should be certain before we prescribe the drug, before we decide. We need to be sure more than 90% before we decide. If we make bad decisions inside hospital, inside CCU for example, it's a death or devastating morbidities. If you aren't sure, get sure. In our practice, we do further investigations, further imaging to be sure. But in exam, you're never gonna be sure more than 90%. If you reach the percentage 51% you are sure, in between options A, B, C, D, pick that answer and shift quickly to second answer. So decide your answer when you are sure more than 50%. A or B, ask yourself, what's the probability of more than 50% you are sure for this answer, and done it. Because further thinking at this point will not improve your answer. Further thinking will make you feel better about answering and change your decision. Obsessions, rethinking, overthinking will kill your answer. Once you make a decision, do it. Move on. Stop agonizing. It's okay. It's an exam. It's not a big deal if you make it wrong. It's not a decision inside CCU or hospital that will make somebody suffering. I hope these four facts I explained will get benefit. Next part will be the remaining facts. See you in other parts.